All right. So I think it's probably easiest for you to tell us a little bit about yourself and to tell us your story. I know I came across some of your work and writings and then it turned out that you'd been to some events that we'd done. So it was kind of serendipitous. So so do you prefer Regina or Regina?
Regina.
Regina. I think Regina is more common in Canada,
Hmm.
that pronunciation. Yeah. So tell us a little bit about your story, because everyone loves to hear people's stories, how you got from your mother's womb to being at a counseling center in Auburn, California.
Oh, sure. That's a long journey. But I was born in New Orleans, and so I'm a member of the United Homa Nation. Um, and it was very serendipitous that around that time that I became a tribal member. My sister threw do you remember the Dr. Scholl shoes, the wooden shoes? Threw a shoe at
Mhm.
my eye. And my eye was swollen shut, and I had no idea my parents were going to be going on this journey, getting all the birth certificates of my mom's ancestors the next day. But they didn't want to send me to school like that, so they took me with them. And that was around the time that they decided to enroll us in the tribe. And I feel like, over time, what's been revealed to me more and more is like that happened for a reason, that I was meant to go on that journey with them because I did. And hi, Sheldon.
Hi.
Hi. And I did become more and more connected with the Indigenous identity of our family over time, from especially after that point. I mean, I would say it was one of the things. And I also had a aunt who was Blackfoot when I was a little girl, and we go out to Grand Isle, which is a place that a lot of the families summer in Louisiana, on the Gulf of Mexico. She would just walk around with me and, identify different plants. And, it was a very nurturing kind of moments that I had with her, but I think it influenced me as a young one. And then it felt like when I left high school and went to college, I wanted to go to Dartmouth, and they called my mom, and she didn't tell me on time that they called, and they said, well, we don't think we can, your daughter's too light. We don't think we can bring her. So we don't think that, people will question, whether she belongs part of our indigenous community. And she didn't tell me right away, or else I could have maybe fought it. And, but then I just felt like, well, maybe the universe didn't mean it would, there was something pulling, but that wasn't the exact direction or time. So when I went to graduate school in the University of Washington in Seattle, and I was very far from home and trying to figure out where I belonged in this world, that I was drawn towards the indigenous community, as far as that being, part of where I felt like I belonged, the connection, resonance, culture, and also met some Hawaiian friends there, which one of them introduced me into her halau way back then, and I began dancing hula, and just also exploring, my identity, coming from New Orleans, my family culture, and then participating as well in the community up there on the West Coast and in Seattle before I moved back briefly to New Orleans and then came out here to California.
It's terrible to hear that Dartmouth thought your skin was the wrong color to
Right?
to university. I'm
Yeah,
just, I'm just shocked, and
yeah.
because
That's the,
yeah,
that was the call my mom got. That's what was said to her. So it's interesting.
yeah, yeah, because indigenous people come in all flavors and colors.
Absolutely. Yeah.
Shame on you, Dartmouth.
You know,
Uh, It was the 80s and yeah, I mean hopefully it's gotten better, but I don't know.
Yeah. Mm.
I certainly have, found a lot of places that, just discovering more about that part of myself at when I got to graduate school has taken me. So um, that was not the route that was meant at the time in that way. And the universe was doing its thing. I don't
Yeah.
know.
Yeah. One door closes and another door opens.
Mhm. Yeah.
Yeah. So you got from the University of Washington to your clinic in Auburn. Where fill us in. How did
Okay. So I studied social work and when I went back to Louisiana, I got licensed in social work and then moved out to the West Coast and continued working in my field. I worked a lot with addiction. I worked a year at the VA, working at their addiction treatment center and then residential treatment in New Orleans and outpatient. And then I moved to California and did 10 years of child welfare work. Um, During that time, I was trying to prevent burnout. So I studied with the Center for Mind Body Medicine. I really attribute that as a lot of what allowed me to not get burnt out during that time. And I became chair of the American Indian Employee Committee at the county, which gave me a lot of purpose outside of the day-to-day work of that job and that position. And I was able to work with, colleagues that had tremendous passion around, advocating and around, around ICWA and around um, making connections with the Native organizations that were there. At that time, I was in the Bay Area, and so San Jose, California.
mm,
And but I at one point I started to feel a pull to want to work more directly, and I had in my social work program I was clinically trained. I was in the mental health was the focus of my program, and so I felt very pulled to want to do more clinical work and move less case management, and I went into private practice. Um, and I had heard about EMDR. I had been trying to send kids for EMDR, and then I'd talk to their therapist and I'd say, "How's the EMDR going?" And they'd say, "Oh, we're just doing talk." And I'm like, "You bill yourself as a EMDR therapist. What do you mean? This kid has had so much trauma." So I felt a real pull to get out and work more directly. And I could teach a few mindfulness skills when I was on home visits with the county, but I couldn't do the work, the healing work that I wanted to, as far as on a day-to-day level, meeting more frequently, having more contact and so I'd heard a lot about the working with the body and I'd had the experience of training with the Center for Mind Body Medicine and I trained first in EMDR and then I heard something about brain spotting. I ended up in a brain spotting training, not really knowing that much about it, except that it was a somatic modality. And it really blew my mind when I went into the training. Personally, I had such a response to it. Like when one experience was, it felt as if there was so much neural pathway movement that I felt as if like a hand was on top of my head. Like I could literally feel where the neural pathways had moved for the rest of the day. It was, and you didn't need to have a context of what the trauma necessarily was related to. You have something that you start with, something that bothers you currently in life, and then the process will take sometimes even there are roots that could be pre-verbal and it was just so powerful. And the individuals that I was sitting with, and we were doing practicums with one another. also had this very powerful effect. And then I brought it to my clients in my private practice and the way that they responded. But more than that, as I was beginning to bring that work into my private practice, I, thought about how this resonates um, within our indigenous community and the potential of that. It's very decolonizing. We get away from things like um, protocol-based type of approaches, and we don't have to have an emotion on board. We don't have to have a negative cognition. It's just what are you feeling right now? What's bothering you? And we can find an eye position related to that. And it taps through as we use a pointer. I have one. So EMDR has a pointer, brain spotting also has a pointer. Um, but instead of the bilateral back and forth that EMDR has, brain spotting, we actually use the pointer strategically to kind of find the eye position, but in a way of following that person's brain and nervous system. Um, so I might just ask, like, do you feel it more here? Do you feel it more here in the center, or do you feel it over here? And then the person would let me know where they're noticing that they get more access. More access might be the sensation within their body, or the intensity increases some, or they notice, something different that they weren't noticing before. And so then we'll find a direction to work from. And the concept of directions, there's a cultural resonance in that, right? Just thinking about that for our indigenous communities. So we so we work with finding the place where their eye position kind of matches with what they're feeling inside, and sometimes we even also just notice where they spontaneously look. So when we're talking to someone and it looks like they're kind of daydreaming or they're not looking at us and they're telling us about something, that's a sign of something trying to process. So we can also say, would it be okay to, continue to notice from where your eyes are naturally going? And we can process from that, what is what we call in brain spotting a gaze spot. So their eyes where their eyes gaze naturally goes. But it's very gentle in the approach is in the way that we tend to follow their system. So we're always using invitational language. And it's not protocol. So we are able to but like say I'm holding the pointer and we found an eye position. I don't say you have to continue to look at this pointer, so it could be that they start looking somewhere else. I'm just going to hold the pointer in that spot and use it as an anchor and check back with it, and see what changes because they could be working through something by looking in other places that just that first finding that first spot was like the place that started the process. And so it doesn't mean that they're not processing. Um, so it's very anti-oppressive in that way, of really honoring this system. And there are ways to work from more of a resource place for those who have higher levels of trauma that might not be able to stay within their window of tolerance otherwise. And there are ways to layer support in, but we don't stop the process in order to um, and start actively resourcing someone because we think that we need to do that. And even if we layer in those pieces, we don't do it to stop their process. We don't stop and say, okay, now let's ground you. We might add in something that's going to keep, like they might say, okay, I feel like this is too much. I think, maybe this is getting too uncomfortable for me. Then I would say, okay, would it be all right if we try working from, say, one eye? And we also work with one eye, which I feel like has some cultural resonance, thinking about, the whole concept of like two-eyed seeing. So if you work with one eye, the whole experience may be different with one eye versus the other eye. So sometimes if somebody feels like they're getting to that point that they're getting in fight or flight, and they name that, then I could say, okay, let's cover one eye and then switch and compare with the other eye. And what there might be a side that, well, there generally is a side that's going to be less intense. And so we'll work from that place, but they'll continue to process. And then eventually we might switch eyes, and then they find that that first eye that was so um, intense that they wouldn't have wanted to work from at all has actually gotten to be less intense after working with the eye that was less intense first. So we're able to kind of move with them in their process, but by following, we stay in what's called the tail of the comet.
Mm.
So, we try not to lead the process. So it's very different in that because sometimes people come in this psychotherapy and expect us to lead their process and be the one who's knowing. But brain spotting allows us to not be the expert in the room, but to really be have a very attuned presence, but allowing their process to lead and that their wisdom comes from within themselves.
Mm.
Oh, Louis, you're muted.
Can't hear you, Lewis.
It seems like what one of the things that you're doing is teaching people, helping people, facilitating people, connecting with what's going on inside their bodies. So interoception. And um, and I think the dominant culture encourages exteroception. So
Mhm.
ignore what's going on
Mhm.
inside your body and pay attention to the dangers outside of you. And which is I suppose appropriate if there's a lot of danger outside of you, but but it doesn't get to the healing of trauma.
But we are also working with the danger outside of you too, in that the eye position often can come from, like if there was a lion or a tiger, right? Our eyes would go straight for that, right? Or if it was a car getting ready to hit us, we might look at that or we might look away from it, right? Because that might feel more safe because we know we're going to be hit. And so sometimes the eye positions come from that and helps to resolve those kind of traumas.
Yeah.
Um, mhm.
One of the things that I'm really interested in. So I also did the Center for Mind Body Medicine training,
Okay.
and before that, I was um, very steeped in meditative practices from the East, and I teach them in addition to the journalism work that I did. And it feels like one of the things that you're working with people is to help them become more aware, of what's going on within them and around them. And um, it sounds like you're coming at it in different ways, through the brain spotting and through mindfulness and through cultural traditions and through EMDR. And it sounds like it's really powerful to not sort of come from the magic bullet, like this is the thing I'm doing, and it's going to help you, kind of thing.
I would say that brain spotting and somatic experiencing are the two I use most. Um,
Uh-huh.
I very seldom use EMDR. I feel like it can be life-changing in my experience, but at the same time, it's more protocol driven.
Mm-hmm.
And there's really nothing that I uh, might want to work with that brain spotting couldn't do that, work with that EMDR would. So it's
Mm-hmm.
still a skill that I have, and I could apply it if I feel like I would want to, on a given session. But I've really moved more and more towards brain spotting, and sometimes I'll incorporate some somatic experiencing because I'm also an SCP.
It also sounds very collaborative.
Mhm.
You're not imposing.
Mm-mm. Yeah, and it is nice to to move within what a person may need on a given day, um, for sure. It's collaborative and it's very honoring of their system. and it brings in that concept of not knowing. So we might begin working with something, but there may be connections that their brain and their nervous system make that might be things that were original roots that they might not have even been aware of that begin to arise and come up in the process. Um, there can be many things that are moving in one session, and people become aware of things that they may have had 20 years of talk therapy and may have never thought to even mention to their therapist, So it's really a, very quick moving kind of process. And what's really good is that when something does shift, it tends to hold. And so then we just the next times that we work, we look for what might be dangling at that point. Oh, Louis, you're muted again. If you're saying something to us.
Sorry, there's an air conditioner in this room and I was afraid it was making sound, but maybe it's not, and I don't have to worry about the air conditioner distorting the um, audio.
I don't hear it. The Zoom is good at tuning out a lot of things these days.
It is, it is. You know, it was so fascinating. Yesterday, I was on a Zoom call with some nurse practitioners, and my dog was barking wildly in the background, and they didn't hear him
Mm.
at all. And I thought, wow, Zoom, you've really figured this out. Audio
Yeah.
engineering. Yeah. No, I was thinking about how so much of psychotherapy is really avoidance of introspection.
Mhm.
It's sort of data dump of what happened during the week and not very helpful in terms of skill development or processing, and I have I have clients who come and it can take 8 or 10 sessions for them to just stop talking,
Mm.
to get everything said. And then I'm like, okay, now do you want to do some work? Should
Yeah,
we? Should
I get that feeling sometimes. Yeah.
and yet it seems important to them. I mean, to sort of tell their story ongoing. And I remember one woman I said, is telling me about everything that happened in your week, keeping you from addressing the question of whether you really want to be in your marriage.
Mm.
Because it seemed to me that it was. Um, and using something that brings the awareness into what it feels like to be in the body seems to me to be so much more helpful than just rambling, as people are wont to do.
Yeah. But I listen when the people want to talk. I listen for, what is the kind of entryway when the thing that they're most interested in exploring and being curious about together as the, place that when they're ready to,
Mhm.
to go deeper, it's often in something I've heard. Um, and I might sometimes remark to them, well, that would be a really good thing in the brain spot because I don't really know the answer to that. But, I feel like, or I could give you my thoughts or my ideas, but, that if we went into your process and your system, it may come up with something much more profound than anything that I might offer. Um, so that it's, just really deeply honoring the internal wisdom.
Mhm.
And a lot of times it's hard to get people out of the thinking brain because they're so used to it's productive in our society to be more dominant with that. But in working through the things we can't work through with thinking, right? There are other really, the potential of the brain is so infinite to be able to um, tap into that is really powerful, that things can then move that wouldn't just through trying to, problem solve it with thinking.
Yeah, yeah. I was listening to um, the book Determined this morning, and by Sapolsky, and he was talking about how the ventromedial prefrontal cortex um, colors whatever's being processed with emotion, and how trauma shrinks it,
Mhm.
and it makes it much harder to think emotionally, think with emotions, as opposed to um, logic or um, opportunism or any of the ways that people think. And I suspect that all of these approaches rehabilitate in some way the poor little shrunken ventral medial prefrontal cortex,
Mhm.
help to grow it, make some new friends and connections and bring some feeling back into cognition.
Well, what we know is that the hippocampus can grow when trauma is healed, and that we know that new neural connections can happen, and new there's neurogenesis, and then there's also neuroplasticity, that can increase as we work through those stresses and traumas. Um, and the brain, begins to think and experience more flexibly. Because sometimes with trauma, the flexibility of our thinking process, can get more limited. And if we, just see in maybe black and white, if we can, begin to have more gray area, as far as our ability our process to be expanded and to be able to see resources where we might not have seen them. Because as humans, one of the things is that we have an ability to, when we scan for danger, we have the ability to hold what was dangerous for us with that prefrontal cortex. That other animals, they experience something, maybe they're chased by something bigger, and then they go from the fight or flight. Maybe they go into freeze if they think they're not going to survive. They get up and they shake it off the next day. They're not worried about it. But for us, we tend to hold the experiences. But this does allow that to move if we're holding it too long, and the tentacles that often kind of grow from trauma being held for a long time and kind of going into becoming anxiety, becoming, other things that we fear or avoid. We can help all of that to shift, which is really powerful.
So I'm guessing that you do a lot of this work in the counseling center in Auburn.
I have two. I have two offices, one in Granite Bay and one in Auburn. So I divide my time equally between the two, but both are like 20. Well, Granite Bay is 20 miles north of Sacramento, and then Auburn is about 10 miles north of that.
And and you're working with a lot of indigenous clients.
I have some, but I would say the place that I'm working more with Indigenous community is doing the brain spotting training,
Mm.
is bringing it to the helpers that and I could share a little of that if what happened was as I began to make my own connections of how this resonated in from an Indigenous perspective, I reached out to David Grant, who created brain spotting. And David connected me with Steve Sawyer, who also identifies as Indigenous. Steve is a Wilbriety trainer and a brain spotting trainer. And so Steve and I came together and we developed indigenous focused brain spotting. Uh, and we there had already been a BIPOC branch of brain spotting that had developed, and I was supporting there and assisting. But I said, David, we're not getting a lot of our indigenous community coming to even the BIPOC trainings. I don't think it's safe enough. I feel like we need to do more to, help our communities to for this to be a place for our communities to be comfortable in approaching. And so that's when he connected me with Steve. And Steve and I have developed that over time. So we are able to bring, in the morning or of any training, we offer a way of opening, could be a prayer or a song in the morning. We we integrate aspects of culture within the training. Um, when and some things we've learned along the way. There was one time that we were doing a training with our community, and it was in person, and there was a fair amount of flight in the room. People were beginning to approach their own trauma because in learning brain spotting, it's an experiential process. You're going to have practicums with your peers. And so there was, with working through their own trauma, there was some flight coming in. And Steve and I were like, okay, well, what do we need to do, to help most support this community? And one of the things that happens is, like I'll say something, I'll say, hey, Steve, I'm just feeling like circles. And he's like, that's exactly what I thought. And when we're both, because we both spend a lot of time in community outside of the trainings that we offer, in ceremonial ways. We both are part of our local Indigenous community where we each live. And so there are things that just come to us that, may resonate. And so the next morning, we took 50 chairs because it was a large training, and we made a circle. And instead of, the chairs being in rows like are typically in most trainings, and you could really feel people's heart come in, and the flight left the room because the circle resonated, right? And so it's those little pieces that him and I take the time, and we have the um, connection with our community that we can be responsive and incorporate, and even in the moment sometimes. And the willingness, we went out to the Quartz Valley Res this year. We were asked, one of our first trainees from the first Indigenous phase two we did, wrote a grant. She went back and wrote a grant for her community. And so the community then had a grant, and they were able to ask us out there. So that was an incredible experience this year. We also had the California Council for Urban Indian Health and California Rural Indian Health Board jointly sponsor training. So as more and more people hear about our work, sometimes they'll ask for the organizations to sponsor. And so we were able to go to, have the trainings where community can come together in one place. We tend to do more of them in person. I think as much as possible. The last time we did it virtual was during COVID, and I was able to talk him into doing one this fall. But it's most often because Steve really likes the in person, and it's incredibly powerful. But then once in a while, offering virtually allows us to be able to bring this access to individuals who are further away. So when we do offer the virtual, those who are on the East Coast, those who are in Canada can be part of our trainings. And we've had three Canadian grandmothers who have been through residential school come to our trainings. And we've had individuals who are EMDR trainers come to our trainings. Um, and so it's been really powerful. One thing we do different in the Indigenous focus training, So when they had the BIPOC training starting within brain spotting, those are BIPOC only identified, and that makes sense, right, for safety. But when Steve and I had to look at what would be most safe for our Indigenous communities and creating this Indigenous focus training, we included those who work in Native agencies who are non-Native because we let the communities define like who is part of the community. So those who attend with us predominantly identify as Indigenous, but then there are some individuals who work in Native agencies. And if the Native agency, feels like this is a person that they consider as part of the community and serving Native peoples, then they are welcome and are part of our trainings.
Yeah. You made me think of a young man who I met at a Sundance. He was quite an amazing young man. He rode his bicycle from Utah to Western New York to go to this sun,
Wow.
and he was advocating. He had just gotten his degree in Native Studies, and he was pushing the idea that um, tribes should reclaim nation status and let anyone apply for citizenship if they could pass a test and be sort of like the United States, um, be accepted by the community. And he said, um, then we'd have a lot more people
Mhm.
and we'd have a lot more political clout. And he was the guy that showed me the math for how the Indian legislation of what was it, the tribal um, census legislation in 1904 was calculated to get rid of all indigenous people.
What
But
other pop?
yeah, it didn't work because indigenous people are still here.
Yeah.
It's a Machiavellian approach, you know.
Our
So
po our policies with native percentage, blood percentage is like that too, right? Like it's not necessarily resonant with our communities. It's like the blood percentage piece was imposed by our government. And if anyone intermarries outside of the culture, eventually you don't have meet the percentage, right? And that was one of my biggest things when I worked at the county. I was asked to say that this young woman was non-native and she was descended from three tribes because she didn't meet ICWA, and she was one generation from in each of those for each tribe from being um, a member. And I said, I stood up, and that young woman and her grandmother were in the courtroom. And I said, I cannot say this is not an Indian child. I can say only say that she doesn't meet, ICWA um, under the way that ICWA is written. But I will not say that this is not an Indian child. And that what really always struck me all these years from that moment is my fear that other social workers may stand up and say that's not an Indian child because they're told to say that, right? Because it doesn't meet ICWA. Um, and that's different. That's like around the piece of having indigenous roots, which is, a different piece than, like expanding our training to include those who are non-native. I think, thinking about that, it's more just about like within a community and when there's ceremony, the individuals, they're not native, but they're part of the community because the community um, embraces them, and they're healers, and they're supporting the community, and the community tend to know who is safe to be incorporated within like ceremony um, and our practices. So that's where really where Steve and I got that piece of that it would be open to that. Those that are working and serving within the Indian health centers and tribal organizations
Yeah.
who are native.
That makes total sense.
Mhm.
Yeah. I was thinking how useful this would be for some of the sobriety coaches in our area in Maine,
Mhm. Oh,
because
yeah.
we have these um, peer counseling specialists who are sometimes 1 or 2 years, you know, from using. And I could imagine how a training that would connect them with their own trauma in teaching them how to deal with trauma would be really valuable for them.
Yeah. The more that one heals and clears the trauma, the healthier the person is. Because sometimes just having worked in many years in addiction, one of the things that can happen if somebody gets sober but they don't clear a lot of their traumas, they have what they call dry drunk kind of, syndrome, right? And so there's a lot of anger, there's a lot of frustration, and it, comes out toward family and friends, and being able to have a place to help that to move those things that maybe the person, maybe they've worked 12 steps, but they somehow haven't been able to get to, or maybe has roots that they don't remember or don't know how to access. So it could be really helpful for that community for sure.
In Determined, Sapolsky was talking about um, brain changes that can be detected at 1 month of age
Mm-hmm.
based on having mothers who have high ACE scores and have been traumatized themselves. And it's just so huge. And yet it's so amazing how conventional mental health ignores trauma. It's
Mhm.
just not on the table. And yet we all know how incredibly important it is. But it doesn't fit it's not a part of the DSM. So it's not important. Therefore,
Yeah.
yeah.
Or it's in there, but it's not addressed as directly, or, in the trauma sensitive kind of ways,
Mhm.
right? Yeah.
I'm
There's a lot.
also struck, Regina, by the way you're describing the training that you do with people,
Mhm.
because I mean it's completely intuitive that if I'm going to work with people on their trauma, then I need to do the work in addressing my own. But as we all know, that's not always the way people are trained to work with people.
Mhm. Yeah. Yeah. So it's built into the training, it's built into the certification process. So individuals who become certified um, are encouraged to, continue to practice with, receive their own brain spotting as well as working with others. And they have a consultant who works with them one-on-one, and really can take the time and, really review and help them understand the different uh, processes or theory, and we also have what the frames where we set up to help find the eye position with someone.
Yeah. Well,
One of the,
go ahead, please.
one of the things that was important initially, I went when I went to David Grand about this brain spotting. We had conversation about who could we train, and he has been pretty flexible with that. He said if we have, yeah, anyone who's a helper or a healer, it is not limited to just a psychotherapist or, um, those who have, psychiatrist, and um, those who have the mental health type of background. We can't, anyone who's identified as a helper, we can train. So he allows us to do that. It's just the person would work within the capacity, what their what's the word I'm looking for? Scope of practice that they would normally have, right? But we can include community workers and substance abuse professionals and the trainings, and those who, who are just helping within a tribal organization, but maybe don't have the, credentials behind their name. We can teach them some basic ways, DV advocates, people like individuals like that, we train.
And at least in my experience, most of the amazing healers that I've known had no credentials,
Mhm.
and yet everyone in the community knew that that was who you wanted to see for certain problems, to be helped. And I don't know, I think about where I'm trying to put together a panel on an amazing healer that I spent time with in South Dakota, Sonny Richards.
Mhm.
And Sonny was a policeman,
Mhm.
and he did healing in his spare time.
Mhm.
And after he retired from the Rapid City Police Department. And yet he was one of the most amazing. I don't know why I say yet, and without the yet, and he was one of the most amazing healers that I'd ever met. And another funny story. So there's these two guys, the Swallow brothers, out on Pine Ridge Reservation, and they're venerated. I mean, people really love them. And one day my wife was out there with our friend Becky Chief Eagle, and they showed up to do the electricity.
Mhm.
And by day, they're electricians.
Okay.
So, so it just you made me think about these amazing people who the system doesn't recognize as credentialed. And um, where I work, we had an incredibly credentialed person show up um, after a long process of vetting him, and he got fired after 1 week because he's
Oh,
so mean to everyone. So that shows you how effective credentialing is.
right. Yeah. Yeah. I mean, the letters behind one's name, if from a perspective with, this work is like it can help a person to be able to bill. Like if someone, is a psychiatrist, a doctor, or a mental health therapist, we can bill for providing, this. If they're an OT, they can probably, bill for it. But the other, if they're good, like you say, they also have done their own work, and just
Mm.
having that credential isn't going to make one a good healer. And also those who don't have all those letters, behind the name can still use the brain spotting in the work that they do as well. So it's pretty versatile in that way.
Yeah, it seems, it's so great that you've adapted this for Indigenous settings, and it feels like you're empowering Indigenous people to find ways that are um, syntonic with Indigenous culture to do the work, and so many of the things that are taught are formulaic, as you know, and protocol driven and not human driven. And so it's so good that, I mean, to me, it seems like wonderful that you're doing this.
Yeah. Well, one of the things that struck me was like I'm like we had to have known this. Like this is it may be that David Grand stumbled onto this, but I would imagine if David Grand stumbled onto it, that Indigenous folk knew this. And so there have been a couple of movies that I've found or documentaries that one was with the young man. He was early young adulthood, and he had went around interviewing elders, and he wanted to figure out why he was, how to deal with his anger. And in that documentary, one of the elders told him, when you're mad and you start to, feel that feeling, notice what your body does. Notice if your hands are balled up, right? notice what's happening. And wherever you're looking, they told him, look in the opposite direction. And I
Mm.
was like, when I saw that in the documentary, I'm like, yes, we knew, we knew this, it's just another way of saying it, or just, David Grant has found this today, but, there, there are elders that have, and communities that have probably had this in their knowledge long before. And David is humble in that way. I'll have to send you a copy of when he spoke at the Brain Spotting International Conference. But he is calling his kind of his theory. He's calling it neuroexperiential. And in that neuroexperiential theory, one of the things he talks about is that it takes into account not just Western ways of knowing, but also being open to indigenous not ways of knowing. That's a really core in this brain spotting approach.
Yeah, that's wonderful.
It's great.
We've
Well,
got a really big movement in Philippines. There's a young man over there who is taken and really redid the slides and brought in Filipino core indigenous concepts and is teaching brain spotting using those slides that show the Filipino indigenous core concepts and how it relates. And he asked me, him and I had a conversation, and because he wanted to know what Steve and I were doing over here, and he asked me if Steve and I were doing that. And while we haven't, changed the slides that are the main phase one and phase two, because all the trainers have, those slides we go by, we do give examples and thinking of these things from an indigenous viewpoint, and then also when we speak, we both had opportunities to speak nationally at Native conferences, and we do have presentations where we do talk about it with indigenous quotes that may go along with it or concepts that it goes along with. So it was neat to have that conversation with the young man in the Philippines and see how he's doing that, and and then to be able to compare notes with him.
yeah, and if you when you talk to him, ask him to if we could talk to him.
Yes.
Sure.
Uh, I'd love to hear what someone is doing in the Philippines.
I
And
can certainly, yes, facilitate your connecting with them. Yeah.
yeah,
That'd be great. Yeah.
yeah. Well, this was really fun. We're getting near the end, and it's wonderful to get to know you and to hear how you're indigenizing a practice that seems really useful and helpful. And anyway, I really applaud what you're doing, and I want to,
Absolutely.
yeah,
Yep. Yeah.
I want to thank you for talking to us. And
Yeah. Thank you to you both.
Yes.
yeah,
Yeah.
It's
so
been wonderful to meet both each of you and to finally be able to converse and, with Lewis, because I've followed your work for a while.
well, thank you. All right, I'm going to stop the camera.